to take medications or to not take medications. This can be a really controversial subject, but hear me out. In school, I was taught that the combination of taking medication and having psychotherapy were your best chances for successful healing. And that's probably true for a lot of people. So the upside of taking medication is that if there's a chemical imbalance, or if there is someone who has low serotonin levels, dopamine levels for whatever diagnosis they have, then medications can obviously raise those and help that person function. The downside of just taking medications is that you're not really addressing any kind of underlying issue that may be causing depression as well, or anxiety. So remember, there's different types of depression. There's biological or chemical depression, there's environmental depression, there's situational depression, and then there's psychological depression. Medications don't just cover the whole thing. Somebody can be really happy just taking medications, but if they have underlying deep-seated emotional trauma or issues that relate to depression, then explain to me how medications help treat that. The other downside of medications is they don't always work for everybody. I know plenty of people that have taken several different kinds of antidepressants or anti-anxiety medications, and they don't do anything for them, or they have a ton of negative side effects. And just like any drug, ask any person that has any kind of drug addiction, when you take in a drug and you ingest that over a long period of time for a certain amount, your body builds up what they call a tolerance. And it's no different than an antidepressant or an anti-anxiety medication. You have to up the dose if they stop working over time, because your body builds a tolerance. And then I've had a lot of cases and a lot of examples of people that I've met with that they've had to switch different kinds several different times. We have more medications now than we have ever had in the history of the United States and the world. And we have higher rates of depression and anxiety than we've ever had. 47,000 people commit suicide every year. So how is that possible? How is it possible that we have all of these antidepressants, anti-anxiety medications, all of the drugs that you could ever want, and the depression rates, suicide rates, anxiety rates keep going up? Explain that to me. Clearly, there's another factor that's involved in this, and that's our environment, right? So our environment, in this world, is a very stressful world that we live in, and so those are the kinds of things that we have to deal with, on a daily basis to be able to function in this world, and it can become very stressful, and that's obviously a factor in being able to cope with anxiety and depression in this world. But for people who have chemical depression or what have you, it's obviously medications is a very valid way to help treat that. But what I suggest in my other video, when I was interviewed on a podcast, is being able to do basic, simple things on your own. The idea is that it's supposed to help elevate those chemicals in your brain naturally. So exercise, living a daily set schedule, going outside, getting some sun, or just going outside, going for walks, getting out of your environment. Dieting is always, a big part of, chemical functioning in your brain. If your body doesn't have the right amount of vitamins and minerals to be able to produce serotonin or to be able to produce dopamine, then your diet can be a big part of how your body can produce that. There's a whole nother slew of ways that people can help their mental health too, and I'm going to do videos on all of these, but one of the best tools that I know of is self-affirmations. So that has to do with psychological depression. So if you're told when you're young that you're stupid or whatever and you're dumb, then you start to believe that, and that becomes a psychological issue that creates depressive symptoms or anxiety symptoms depending on the person. And so self-affirmations, to me, is one of the best ways for people to be able to reprogram their subconscious so that they can start to believe in a different way. A lot of good studies done about meditation and its improvement on a person's mental health and helping cope with depressive symptoms. There's a lot of evidence coming out now about taking cold showers or ice baths, and those are things that have helped a lot of people treat feelings of depression or anxiety. I've had adult male clients on my couch in tears thanking me for being able to just show them how to do self-affirmations, to the point where they have described how much it helped improve their self-esteem. And in their words, they didn't feel like they could feel that way ever. And so just by doing affirmations in a specific way consistently has changed the way that they think about themselves, which has improved their depression. So again, I don't have a dog in the fight, but for anybody that just thinks that medications only is the answer is probably somebody who's got chemical or biological depression. If you take medications and they kind of improve, but you still have situations in your life that cause anxiety or depression or past trauma, or the way that you think about yourself can create depressive or anxiety symptoms, obviously medications don't really do anything for that. They might help elevate your mood so that you can process those things, and that's just fine. But you guys do whatever you want to do that makes you feel better. If it's for me, I'm going to try to do the natural way things first, and then if they don't work, then I might look into medications. And I'll also add this. I do highly recommend for people to take medications if they are at high risk suicide. That is one of those times where it's imperative that something drastic needs to change chemically, even if anything chemically, for them to be able to get in the right mindset so that they have a desire to continue to live. So again, whatever works for you guys. I've known some people that have treated their depression solely with exercise. If they exercise every day, they feel fine. If they miss a day, sometimes that really affects them. So everybody's going to be different when it comes to this. There's no really right or wrong answer as long as somebody feels better, and that's the ultimate goal, right? Anyways, let me know what you guys think about, medications, and if they've helped you, or what your thoughts are about taking medications compared to natural ways of dealing with anxiety or depression. Or for those of you that have done both, how's that helped you or not, or how's that affected you? I'm honestly just kind of curious to know on a bigger sample size what people's thoughts are about this. And I'm not trying to be controversial about it. Again, I don't have a dog in the fight, just whatever helps people. And I just letting you know what I see on a daily basis.